My name is Naveen Bellam. I'm one of the Fits on the Go bloggers, and I'm here today with Dr. Paul Mather, who is the Lubert Family Professor of Medicine at Thomas Jefferson and happens to be the director of the Heart Failure Program as well at Thomas Jefferson University. Nice to see you today.
It's nice to see you, Naveen.
So, as part of the Fits on the Go blog, I'll be asking you a couple of questions.
Okay.
And I think you had recently mentioned that you are one of the co-chairs of the international section.
I am indeed.
If you don't mind, could you elaborate a little bit on what your role is and what the role of maybe the international sections at ACC have?
Absolutely. I think one of the goals of the ACC is to link all the cardiology societies in the world. Everybody has different demographics and different goals on what we're aiming for. But at the end of the day, we have all our patients throughout the world who have similar problems. I mean, you can now divide it into Western society and Eastern society, but the impact of cardiac disease is huge throughout the world. We know that 3 out of 4 Americans will suffer from a cardiovascular complication, but you can translate that throughout the world. And so what we want to do is increase awareness in other societies through their mechanisms, through their national societies. So one of the missions of the ACC is to link the American College of Cardiology with the other colleges of cardiology throughout the world, whether it's in Europe or Far East Asia or Mid-Asia. And now a big push into Latin America also.
So from that standpoint, as an expert in heart failure, taking into account your role in the international sections, have you gained any knowledge of new or evolving therapies that international markets are using or we are using that could be assessed with others?
That's a very interesting question because it's a two-edged sword. Some of you have read that the FDA in America is starting to look askance at all these studies that have an 80% enrollment in Hungary and in Europe and not representative of the American population. So I think what we're trying to do is link these all together so we can have a commonality. You can see that in devices, especially as a heart failure specialist with LVADs. The European CD mark has a lot more aggressive approval of devices, and they tend to lag in coming into our hemisphere. So I'm hoping that as we become more collegial and linked together, we can unify all our patient populations so we can all learn from each other.
Speaking of actually devices and mechanical circulatory support devices, do you see an increasing role, or do you think that medication therapies will, as we already know, the number of transplants have been quite flat for a long time. So where do you see the future in heart failure?
Well, as our population ages, more and more people get heart failure. I mean, they live to develop heart failure. And the number of transplants has stayed plateaued or anywhere between 1,800 and 2,400 a year in America for the last 15 years. So somewhere there's a gap a yawning gap that's occurring. Although I will say that the current generation of approved devices are not the devices of the future. There's a lot to do with GI bleeding, strokes, battery issues, wear and tear. The first generation were the wear and tear. We've gotten over that, and now we're dealing with all the factor V Leiden and Von Willebrand's factors. So I think the next generation of devices that are coming, and we're starting a trial in May in one of them, will hopefully open the door for more device therapy for people with end-stage heart failure. Having said that, with the recent neprilysin trials and the new trials coming with relaxin and other drugs, hopefully that dearth of pharmacological therapy we've had for the last 10 years, we're getting past that. So we need to approach it from both aspects.
Well, we definitely appreciate you taking the time to speak with us today. To find the full segment, you can please go to www.youtube.com/fitsonthego. Once again, thanks for taking the time to speak with us.
Pleasure. Thank you.